Canadian troops don't have provincial healthcare cards. They cut them up when they join the forces. Their healthcare becomes the military's responsibility, and they see military doctors. But the Department of National Defence doesn't provide full-spectrum care. When more advanced procedures are needed, troops use the same hospitals and doctors as civilians, and the military reimburses the hospital's costs. But this spring, a major change. Multiple sources told Global News orders came from within DND to cut healthcare spending. One of the first targets, fees charged by hospitals for seeing military patients. In a move that stunned provinces across the country, the military quietly announced major cuts to what it would pay for hospital services without warning or consultation. Estimates obtained by Global News show drastic cuts to what the military will now cover, from $359 for an ER visit to $93.70, a decrease of almost 75%, and for day surgery, a drop of 96%. And the military will no longer pay for CT scans or MRIs that cost $700 to $800 each. Documents obtained by Global News show hospitals anticipating a major shortfall as a result, an estimated $10.5 million in Ontario and at least $2 million in Alberta.
This will mean an increasing strain on their resources if they don't have the same financial amounts coming in with respect to our serving members and veterans, which will mean that they will likely have to cut back on some of the services that they offer.
Military sources privately told Global News the healthcare budget has been ballooning for years, and they're under pressure to find savings. Defense analyst David Perry warns the move could be risky.
For armed forces and a Department of Defense that spent several years saying that their people are their priority, it's going to look bad if one of the areas where there's an effort to reduce spending is on the health side.
But some military health sources think the feds are being gouged by hospitals and insist the new rates are more fair. Alberta and Ontario say that's not true, and the new rates do not accurately reflect the full cost of delivering health care to CAF members. DND acknowledged the cuts to Global News, but insists it's working actively with provincial and territorial governments and civilian hospitals with respect to the billing changes. The fear now that military members actively serving their country could be denied services or told to pay out of pocket. Two sources told Global News that one Ontario hospital is already refusing military members MRI slots, leaving troops in limbo in a battle they never signed up for. Mercedes Stevenson, Global News, Mississauga.
So, my fellow Canadians, I selected this article in the news, and all credit to Global News for bringing it forward. This ties into a couple of videos that I made in the past regarding Brock Blazczyk, a war veteran that lost a leg and then had difficulty with the current government infrastructure under Trudeau in terms of health benefits for wounded veterans. So this article that I saw, as you just heard, according to the Department of Defense, is planning to cut military health care because they want to try to save money. And, well, all I can say to that is this government is an absolute disgrace. For one thing, they're not out of money. Secondly, they've poorly managed the budget, and now they're taking it out on war veterans who are injured and who require medical attention. So the fact that they're doing this is very inhumane to begin with. And the fact that they're doing this to our troops that have served, shed blood, and died for this country, the fact that they are making cuts to this is absolutely reprehensible behavior. And Brock Blazczyk, in this article here, I believe he was trying to sue the federal government so they could get proper compensation for their injuries, and the Supreme Court refused to rule on the case. So they were rejected. And the citation for that is Canada's top court declined to hear an appeal of a British Columbia Court of Appeal decision that ruled there was no obligation or social covenant between Canada and those who have served in its military. And if you've watched my previous video, I cited this article before, and I'll say the same thing now. We have a staggering social covenant with our military, and we have a staggering amount of obligation and debt towards them. Every single Canadian owes them a debt of gratitude, and whatever they need for medical care to help them get better after an injury and serving in Afghanistan or Iraq, it doesn't matter where, we are at an obligation to help these people. Now, when I read this article here, it sickens me as a Canadian that now I'm hearing that they're going to cut military health care. So, Harjit Sajjan, I really hope that you lose your position as the head of the Department of Defense, the Minister of Department of Defense, because I can clearly see here he doesn't give a damn about Canadians. They're not patriots. They don't care about our troops. The fact that they're cutting here, physicians could bill $105 for a psychiatric assessment under the OHIP fees, for example, but under the OMA fees, they can charge $240 for providing that same service to those not insured through provincial health plans. This government, under their brand new healthcare system, is making it extremely expensive for wounded vets to get the care they need. That's the culmination, that's the conclusion of the story. If I'm looking at it objectively, I can say that the budget is very, very poorly managed, and that Defense Minister Harjit Sajjan should be out. There is no other way. Let the Liberals get kicked out of government. The fact that our defense minister can't even rub together a few dollars to help our vets, that's pathetic. And that's reprehensible. Especially when they're paying $10 million to Omar Khadr and other such rehabilitation purposes for ISIS fighters. That aside, I'm very disappointed in the Minister of Defense. I'm very disappointed in the Liberal government for this shortfall, this inadequate and inhuman a way of conducting our healthcare systems for wounded vets. And as I said before, they deserve our highest respect, our gratitude for the services rendered and for sacrificing their bodies, limbs, blood for this country and for freedom. So I thank you for your time and your attention, and have a good night.